game situations, I may be there, a team doctor may be there, so we have to be ready for what we're going to do to evaluate them. So much of the time, because we maybe only see these every so often, we may be a little uncomfortable with evaluating. So generally, I'm up there looking in the stands to see if there's any ophthalmologists or eye doctors. No, I can't do that. Seriously, we have to be set for evaluating these. So in order of things we do, we bring the athlete over, calm them down. We look to see is there any swelling or discoloration that we see around the eye. That's the first thing. And then we begin to push, particularly around the eye socket and around the eye itself, to see if there's any swelling or pain. The next thing we do is we evaluate the pupils. You've seen us look with a flashlight to evaluate what pupillary movement and see if it's back to normal. And then we might start to look at what's called visual acuity. We have these small cards, and we have them read the card to see if they have blurred vision or double vision, or can they read from a distance of about 6 to 12 inches from their eye, reading what's on the card. Finally, we'll start to look at eye movement. You've seen us on the sidelines looking from side to side and up and down to see if there's eye movement. So what we're doing in all of those 5 or 6 maneuvers is we're looking at different types of injuries that can occur. And in order of the most common with poked eye, one of the most common is called a corneal abrasion. It'll be a scratch on the clear covering of the eye. And those people need, a lot of times we'll patch them. We may put an antibiotic ointment in. But before we do that, we're going to want to evaluate for the other thing is, do we see any foreign bodies? If there's something in the eye and we leave it in, it'll continue to scratch that covering. So we have to go back and do a very close look to see, do we see anything that could be scratching the eye, a loose body, and then wash it out with saline. So that's something that's on our list. Another injury is there can be blood in the front chamber of the eye, and that means it's more significant damage to the delicate structures of the eye, and that person's probably going to need to go down to the emergency room that night. The other thing is if we push around the eye socket and we think there's any concern of a fracture in the eye socket, that's probably going to be one where we have to go to emergency room and get an x-ray, because some of those with an eye socket problem can trap the nerves of the eye, and that's where the eye movement will not be normal. They can't move their eyes through, and that is a period of time of a couple of hours we have to fix that. So that's a really big deal if we think there's a fracture, especially a fracture with a trapped nerve. And I had one about 3 years ago. I don't like those, but we send them down to emergency room. And then probably the hardest diagnosis for me is called a retinal detachment, and that is the function of the eye, and it's very tricky. But if I'm at all concerned about a retinal detachment, I'm going to be needing to send that person to the emergency room. And finally, remember that in a lot of these, I think like for instance in the Kyrie injury, you're worried about could it be a concussion as well when you get elbowed in the eye? Was there an injury to the brain as well, a traumatic brain injury? And so those are all the things that go through our mind in the 10 or 15 minutes that we might evaluate somebody being poked in the eye. And when you're not sure, poked in the eye or elbowed in the eye, in both cases that I mentioned, Zion Williamson and Kyrie Irving, they both sat out, Kyrie a week or so as he was being evaluated. Zion really returned, so it must have been something more like one of the scratches or corneal abrasions. Zion returned to play on Saturday. But those are some of the things that we look at with eye injuries on the court or on the field.
Joe, the eye itself, though, it's really resourceful, isn't it?
It is, and it's super important, super delicate. Think of those things. Again, the way we're made, the eye is recessed back into the eye socket a little bit for protection. It really is pretty protected, and so most of the time the socket is going to interrupt anything. If it would be a ball to the eye or an elbow to the eye, mainly the socket's going to take. So the fact that it's recessed, but it is very delicate. These structures are very important, and with injury, and it's not always as easy right on the sidelines, if there's a question, I'm going to ask for my emergency room doctors to help me out and send the kid down to be evaluated in some situations.
Very nice, Joe. Thanks for coming on. Good insight, my friend. Catch up with you soon.
Have a great week, Ray.
You too.
Thanks.
Dr. Joe Congeni at Akron Children's Hospital joining us this morning at 1590 WAKR. And I think if you hit the reset button there on that conversation, any question about an eye injury to your kid, even if they're out in the playground or they come in from outside and you have a question, there's blood or there's blurriness, get them to the doctor.